How are you doing today?
I'm all right. How are you?
I'm good. My name is Emily Booth. I'm the speech language pathologist here at the JMU Medical Center. And so today I'm going to be talking about your swallow. All right. So are you ready to get started?
Let's do it.
Okay. So first I'm just going to show you what a normal swallow looks like. So there are three main components to the swallow. First being the oral cavity up in this area. So this is you.
Oh,
Look how
wow.
gorgeous you are.
Look at that.
Yeah. So up in here is the oral cavity where your teeth, tongue, and lips are. Everything that's going to help you chew up that food and get it ready for the swallow. And then once you're ready for the swallow, it's going to get pushed back down into this area called the pharynx, and this is where it's going to squeeze that food down into your stomach.
Ooh.
And then up in the front here of your throat is the larynx, and this is your airway for breathing. And so if food were to fall into the airway, that's aspiration when you choke and cough. So do you have any questions about the normal swallow?
I do cough sometimes.
So that's actually what we're going to be getting into next. I'm going to show you some of my findings with your exam. So first,
That's me.
that is you. Look at that. So first we're going to look at where you swallowed a consistency similar to a milkshake. And I want you to pay particular attention to your head positioning in this video. So we'll take a look. So here your head is tilted back. And
I like to chug them.
yeah. And did you see how some of the food fell into the airway? And then you coughed, which was really great to try and get some of that out.
There that goes.
But if we go back to your head tilting, we can kind of see how the bolus fell into the airway. Do you see that? All right. Do you have any questions so far?
I don't think so.
Okay. So moving on, now I'm going to show you the difference between taking a large sip versus a smaller sip. So we'll watch that. So this is the regular larger sip.
Small sip thin. Cup sip.
So in the smaller sip, we can see that there's tighter closure going down into the stomach. Do you see how
I'm
it's
looking good.
yeah, it is looking a lot better with the smaller sips, which is awesome. And now we're gonna watch continuous sipping, so kind of taking when you took the multiple sips in a row. So we'll watch that.
Cup sip thin.
Here it is.
Cup sip continuous.
And did you see some of that? How
Ooh.
it fell in?
There it goes. Yep. I see it.
There you go.
There. Down the hatch. Down the hatch.
All right, and then the last I want to show you is taking your medicine. So we'll give this a watch.
Oh.
And did you see how it kind of fell into the airway again?
Ooh. Oh, baby, I see it.
All right. Do you have any questions so far?
Man, that just looks crazy. That's crazy.
So, off of these findings, you do have dysphagia, which is a swallowing disorder.
That's what that is.
It is. But it's really common in people with Parkinson's disease. And so your throat just works a little differently as well. But do you have any...
Makes sense
Makes
now.
sense. Yeah,
I
that's
just be
great.
coughing sometimes. I don't know.
Yeah,
Makes sense.
that's all right. So with the coughing, I'm going to give you some strategies that you can take home and start working on today when you get home.
Oh, send them over this way. I need those.
All right. So I have a sheet for you here that we can go over. So my first recommendation is I want you to continue with your normal diet, which is great.
Good, I'm a foodie. I like that.
So you can keep on eating and drinking like normal, except when you're taking your medications. So when you're taking that pill 3 times a day, I want you to take that with applesauce instead of water. It's already hard enough to swallow a pill, and so having to swallow that with a thin liquid like water with a solid pill is pretty difficult. So applesauce with that is going to make it easier and safer. Great, awesome. Next, I want you to be using those small single sips. So no big gulps. I know.
I like to chug my drink.
I know, but using the smaller sips is great because you can, yeah.
I'll learn one day.
Oh.
I'll learn.
But it is frustrating. I feel for you. But no chugging and no gulps. Really try to make those small single sips. Do you have it?
I'll try my best. I will.
Great, and that's all that matters. Moving on, I want you to be brushing and flossing your teeth before and after every meal.
Wow! Dang! That's a lot. That's a lot of flossing.
It is a lot of times.
Woohoo!
You're right. But it's really important to keep your mouth clean because if you choke, you don't want any of that bacteria in your mouth getting into your lungs. So maybe a good reminder to clean your teeth would be every time that you take your medicine. Also clean your teeth since you do that 3 times a day.
Smart
Is that
cookie
good?
over here.
All right.
Smart cookie.
Do you have any questions?
Okay.
All right, great. And then my last recommendation for you is to eat and drink sitting upright with your head in a neutral position, so kind of a straight line. I have a little figure here for
No
you.
more chugging.
No more chugging. I know. It's a little disappointing, but yeah,
If it's better for my health, I'll do it. I'll do it.
Great. Yes, that's awesome. So yeah, just making sure that head's in a neutral position instead of leaning back. All right.
Thank you so much.
Of course. So these are all things that seem pretty doable for you and that you can work on at home. All right, awesome. So I also just wanted to talk about your diagnosis. So as Parkinson's advances, it can affect your swallowing muscles, and so that can lead to worsening difficulties with your eating and drinking. And so please know that I'm here to support you throughout this journey, and my goal is to ensure your comfort and well-being. And so
Thank you.
of course, please feel free to share any questions or concerns you have throughout the rest of your time here, and also when you get home, I left my email down here for you. All right.
Thank you so much. I'll be emailing you if I have any questions. I appreciate it.
Of
I
course,
appreciate
of course. I'm here for you, so. Okay, so now are you ready to get into some exercises that we can work on? All right, this is the exciting part.
Let's see.
So the first one that we're gonna do is working with a little tool, which is exciting, a tongue depressor.
So what is it gonna do? Why am I doing this?
So this exercise is going to strengthen your tongue, which is really important in having a strong and safe swallow, which is really great. So I'm going to have you stick out your tongue, and I'm going to use this to push down, and I want you to push up against it.
All right.
All right, and we're going to do this for 5 seconds. Ready? Go ahead. 3, 4, 5. All right, how was that?
That was good. That was bad.
Felt okay? All right, I want you to try it for yourself. So I'm going to give this to you, and I want you to push down with your hand and use your tongue to push against it. And I want you to try it for 5 seconds. Go
Okay,
ahead.
I'm gonna go. Count me off. Lady.
All right, ready? 1 Mississippi, 2 Mississippi, 3 Mississippi. Push really hard. 4 Mississippi, 5 Mississippi. All right.
Woo!
Nice job.
That was fun. That was fun.
Good. So
like
would you
that.
be okay with doing this for 10 seconds for 20 repetitions?
Okay.
Every day?
I could do that one.
All right, that sounds good.
I like that one. I like it.
Okay, and then the next exercise I have for you is called a supraglottic swallow. So I want you to sit upright with your feet on the ground, and I want you to grab your chair. So you're going to be, that exercise was not during a swallow, but this one is going to be when you're taking a swallow.
Oh, I see there.
So I want you to kind of grab the chair and pull up, like push your body into the chair so there's a lot of tension and it's really tight.
Woo!
Yep. And I want you, so I want you to take a deep breath and hold it forcefully, and then I want you to swallow.
I might go to the bathroom real quick. I don't know.
Yep, it's a lot of tension. You're right. So take a deep breath and hold it forcefully, and then swallow really hard, and then cough. Nice. And then swallow again.
Ooh. Why am I doing this one?
Great.
Why am I doing this?
That's a great question. So this is actually going to strengthen those swallowing muscles while also protecting your airway. So it's kind of like a
That's what
2-for-1
that does.
deal.
Oh.
So we can practice
There we
one more
go.
time just to
Okay.
make sure you. So we're gonna take a deep breath and hold, swallow really hard, and cough, and then swallow again.
Whew.
How did that
That
feel?
takes the life out of you, huh?
It is. It
Ooh,
is very
yeah.
fatiguing, but it's hard work. So do you think this is something we could do for 2 meals a day, maybe for the first 5 swallows of your meal?
Yeah, I don't know if I want to do it all that much, but
Mhm.
I will if I have to.
What about going down to maybe 1 meal a day?
Ooh, I like that.
That's a little
that.
better.
Yeah.
All right, that's a good
I
goal.
don't like that one that much. Like,
Okay. Do you have any other questions for me today?
I don't. You've been great. You taught me so much.
Thank you so much. I appreciate it. Well, this is for you to take home. Again, my email is at the bottom.
Oh, thank you.
Of course, and have a great rest of your
Thanks. I get to get out of here now.
Yep. Have a